Hi, my name is Itchel Velasco, and I'm going to talk about mutagenesis in norovirus in response to Favipiravir treatment. Here, I leave you my social media so you can follow me. Definition. Norovirus is a major cause of sporadic and epidemic gastroenteritis throughout the world. Severe manifestations are seen more frequently in children under 5 years of age, over 65 years of age, and in immunocompromised individuals.
Spreads quickly and easily from a sick person to others. It causes vomiting and diarrhea that come on suddenly, often before you can get to a bathroom. If you get sick from norovirus, you might splatter drops of vomit or poop from many feet in all directions. Norovirus symptoms can strike any time, any place. You could be at the fair or out shopping. It's extremely important to clean up the entire area immediately after you vomit or have diarrhea so others don't get norovirus. Cleanup must be thorough to not miss any drops of vomit or poop that can't be seen. Here's how to clean up after someone vomits or has diarrhea. Step 1. You don't want norovirus to get on your hands or in your mouth while cleaning up vomit and poop. Protect yourself. Put on disposable gloves and a mask if you have one. Step 2. Wipe up vomit and poop with paper towels and put them in a plastic trash bag. Step 3. Pour bleach cleaner on all surfaces that may have vomit or poop on them. Leave the bleach on surfaces for at least 5 minutes. You can use a chlorine bleach cleaner or make your own by adding 3/4 cup of bleach to 1 gallon of water. Step 4. Clean all surfaces again with hot water and soap. Step 5. Remove your disposable gloves, throw them away, and take out the trash. Step 6. Remove and wash all laundry that may have vomit or poop on them with hot water and soap. Step 7. Wash your hands with soap and water and call it a job well done. Help squash norovirus. Always clean up the entire area immediately after someone vomits or has diarrhea. Learn more at cdc.gov/norovirus.
Have you ever heard of norovirus? You've probably gotten sick from it before. Affect your stomach or intestines. It causes stomach cramps, diarrhea, or vomiting. Millions of people get sick from norovirus. And objects. So if you touch something that has norovirus on it, you can get sick. Other ways you can get norovirus are eating contaminated food or drinking contaminated water.
You can help protect yourself from norovirus. Wash your hands with soap and water often, for at least 20 seconds every time, and avoid touching your mouth. It is especially important to wash your hands before handling food, or after using the bathroom, or changing a baby's diaper. Disinfect surfaces and objects in your home. You can get rid of norovirus on surfaces by wiping them down with a bleach-based cleaner. Wash clothes and linens that might have poop or vomit on them, and then machine dry. Rinse fresh fruits and vegetables before you serve them, and cook shellfish, such as oysters. thoroughly. If you're sick with norovirus, stay home and drink plenty of liquids so you don't get dehydrated. Remember, you can spread norovirus even after your symptoms go away, so avoid taking care of others or preparing food for them for at least 2 days after you start feeling better.
Staying healthy helps others in your family stay healthy too. That's especially important for young children and elderly people. Norovirus is the #1 reason young children visit the doctor for diarrhea. Children in daycare or schools are especially at risk for getting sick. Elderly people also have a higher chance of getting norovirus and suffering from complications, particularly those in long-term care facilities like nursing homes.
You can help. Put prevention first and squash the stomach bug.
Applications. Chronic norovirus infection in immunocompromised patients can lead to malabsorption and other complications. Currently, no treatment has proven to be effective. Favipiravir is an antiviral medication that has been approved for the treatment of influenza in Japan and has been used by some as treatment for Ebola virus infection, with mixed results. Preclinical data have shown that favipiravir can induce mutagenesis and impair norovirus infectivity in mice.
Japan said Monday it is ready to provide a Japanese-developed anti-influenza drug as a possible treatment for Ebola. Secretary Yoshimura Avigan was developed by Fujifilm subsidiary Toyama Chemical Company.
Pros and cons. With treatment, the patient's diarrhea and the use of adjunctive loperamide decreased, his body weight increased, and the norovirus viral load decreased. An increase in serum levels of aspartate aminotransferase, alanine aminotransferase, and alkaline phosphatase on liver function testing prompted a treatment interruption on day 19, and the patient's gastrointestinal symptoms promptly relapsed. Reintroduction of favipiravir was associated with rapid deterioration in liver function test results and treatment interruption on day 6. On both occasions, he was also receiving intravenous levofloxacin. Issue in Ecuador. There are no exact data on the incidence of norovirus in Ecuador. However, approximately 1 in 5 cases of acute gastroenteritis that causes diarrhea and vomiting is created by norovirus. Conclusion. In summary, despite the presence of complex coexisting conditions, the patient in this case had some symptomatic response to favipiravir treatment, along with evidence for selective pressure on the infecting norovirus population. Further, a study of favipiravir for chronic norovirus infections should be considered.